they're getting ready for the mic, I know both of these doctors, and there are some outstanding doctors dedicated to serving the people of Guyana at the biggest and largest hospital in Guyana, the Georgetown Hospital. So I was honored I'm honored to know them, and as they log on, there they are. Thank you, docs. And Doc, if you're speaking, I'm not hearing.
Is everybody hearing me now? I wasn't getting to unmute my mic. Hello?
Yes, we can hear you. We can hear you now. Thank you.
Yes, you're good. Yes, thank you.
Are you seeing the screen? Good morning, everyone.
Yes, we are seeing the screen. Thank you.
Okay, thank you. Give me 1 second, please. Good morning again, Pastor Mark and team. Thank you for having my colleague and I. And as you said this morning, we're going to be sharing cancer care in Guyana, or to be more specific, cancer care at the Georgetown Public Hospital. So the Georgetown Public Hospital Corporation is it's the national referring hospital in Guyana, and the oncology unit is a specialized clinic at the hospital where we receive referrals countrywide from both public and private sectors. And there are 4 main components of cancer control. These include prevention, screening, diagnosis and treatment, and palliative care. So note, at the unit, we practice treatment alone. We are a treatment center, so we focus on treatment at the oncology unit. Presently, we have a total number of patients registered in the clinic is 1,221. Our stats may be a little off due to timing. We didn't get all the accurate information. And we have approximately 55% of that being female and 45% being male. The most prevalent cancers seen within the unit is in this order that we have listed here: breast, gynecological cancers. These include cervical, ovarian, uterine, endometrial, and vaginal, followed by prostate, colorectal, lymphomas, ears, nose, and throat cancers, leukemias, and lungs. To note as well, in the unit, we usually see adults, so our cases for leukemias may be a bit low. That's because the children are usually followed up at the pediatric section, not at the oncology unit. So all the leukemias, pediatric leukemia cases would be seen there. Diagnosis. So in order for us to reduce morbidity and improve survival outcomes for cancer, we need an accurate and timely diagnosis. And in order for us to do this, it's a combination of clinical evaluation, laboratory testing, histopathology testing, and radiological testing. Clinical evaluation, this is where our human resource come into place. At the unit, this is the staff we have on hand. We have 1 medical oncologist, 1 hematologist that recently joined us in February. We have 1 cardiologist, 2 medical registrar, 2 medical officers, 4 nurses trained in administration of chemotherapy, 1 social worker, and 1 nutritionist. And the services that we have available at Georgetown Public Hospital Oncology Unit, these include histopathology. This is where we have the testing of our biopsies. We also have immunohistochemistry testing. However, these samples are sent overseas, so we have a delay with the results since it have to go to Trinidad. We have like a 3-month lapse, 2-month lapse waiting for these results. Laboratory services, that's readily available at the hospital. Imaging services, we have ultrasound, X-rays, CT scans. However, the CT scans, there's a cost attached to that. So there's a lot of times our patients can't afford to do a CT scan, which kind of make it a bit difficult for our work when it comes to staging these patients and having an accurate staging for these patients. Now I'll share another presentation and allow my colleague to do another part. Just give me 1 second. Can you see the new PowerPoint?
No. It isn't up as yet.
Give me 1 second. I think I may have to stop sharing screen and
Yes, if you change screens, you need to stop, share, and reshare.
have to do that.
While Dr. D gets ready to transition, Dr. Munroe, Dr. Munroe not only works with the oncology, but also he has worked throughout the years with us for our medical outreaches. So.
Good morning again, everyone. Dr. Munroe here. Treatment. Treatment available at the oncology unit include a combination of surgery, chemotherapy, radiation therapy, which is external beam radiation therapy. And this, of course, is something that has to be paid for by the patients because our hospital is a cooperation. So we have some aspect of private entities there. And at the Cancer Institute, this is paid for. Internal beam radiation, like brachytherapy, that is only offered outside of Guyana. So patients would normally have to be, arrangements would have to be made via Ministry of Health, along with the patients, of course, to contribute to the funding for that. Hormonal therapy is available, basically for breast cancer patients and prostate cancer patients. And these are the hormonal treatments available: tamoxifen, letrozole for breast cancer, and Androcard for prostate cancer, which is not being used in many parts of the world at this time, I was informed. Targeted therapy, which includes Herceptin, and this is for breast cancer patients, of course, some breast cancer patients. Next slide, please. So I'll now give you a summary of what was discussed. The diagnosis and treatment of cancers at GPHC is a work in progress. We have many areas that require strengthening, which include histopathology. This would entail biopsies, etc. Radiological services, for instance, bone scans, MRIs, and these are not available at GPHC. Any patient that has to do an MRI has to go to a private institution in Guyana presently to do this scan. PET scans also are not available at Georgetown Hospital. And of course, the radiotherapy services, which were mentioned previously, they are not available at the public part of the hospital. Targeted therapy, the only thing we have presently at the oncology unit is Herceptin. We don't have targeted therapy for any other type of cancer. Next slide, please. These are some items that we have listed here for consideration. These are some things that can possibly help our unit, our patients, and treatment-wise. For instance, some things like the anti-nausea wristbands, because of course, as some persons would know, chemotherapy gives lots of patients, one of the side effects is nausea and vomits, motion sickness bags, because as presently patients, while they're taking chemo, of course, we give them pre-meds to help with such things. However, there's still some patients that while they're on chemo or while they're receiving chemo, they experience motion sickness. Infusion pumps. Presently, we only have one infusion pump, and infusion pumps, they help to time the drip, right? The rate at which the chemotherapy is being given. Presently, we only have one, so most of the work is done manually, which of course, you know, can be complicated at times. IV UV protection bags, these are because there are some chemotherapy drugs that will not be as potent when exposed to light. Presently, we do not have things to protect such drugs. Breast cancer compression stockings. These are important. Lots of breast cancer patients, after they would have done a mastectomy, because some of the nodes from under the arm are also removed. They sometimes have edema, or what we refer to as lymphedema, under there, and sometimes the arm is swollen, and the compression stockings, this helps greatly with that, and sometimes they're not readily available, and sometimes they're quite costly for patients. Mastectomy bras also is quite important. Lots of patients, because of course, they're women, they're accustomed to having their breasts, and when it's removed, this is an added something that they deal with, and sometimes these are hard to find also. Next slide, please. Thank you.
Thank you, Dr. Munroe. Thank you, Igar. Thank you for outstanding presentation. Rotary Club of All Nations, let us give them a warm appreciation for their outstanding presentation, very informative.